poverty and securing child safety as very much interwoven, and sort of trying to turn the conversation to what we as a state are doing around family support to make sure that families have what they need for their kids. So I would say over the past couple of years, the big wins have been focused on some issues that we've been working on for a long time, and then other things that just kind of fell into our lap that we picked up and ran with. In our state, the TANF program is called Reach Up. And so for a long time, we have been pushing for increases to our TANF grants and changes to program rules. Last year, we started the year with a really bold proposal, and we had an amazing champion in our House Human Services Committee to basically bring Reach Up fully up to, it would essentially be to the poverty line. So basically fully fund that TANF grant for families to meet the subsistence level that the Department for Children and Families determines. And as that bill progressed through the legislature, it encountered a little bit of resistance, and so it became more of a policy change bill. And effectively, our administration agreed to really change the definition of participation so that it's an engagement model versus a work requirement model. We effectively got rid of work requirements. And so there's a whole list of activities that fulfill the participation requirements for folks, families receiving TANF. It includes things like addressing, your substance use disorder, addressing lack of housing. It's like, and then there's supports that are wrapped around, at least ostensibly, to make those things happen. So there was a little bit of an increase. There was an increase to the child support pass through that's allowed, and I think an additional $50 or $100. Should look that before this, and then a $100 increase to the amount of earned income that's set aside as people begin to work. So a little bit of progress there, and I think this year our goal is to come back and see if we can get, at the very least, get an increase in the grants, and ideally, the goal is to have them come right up to the full level of what's the word? Basic needs. Basically, have basic needs level fully funded and get it indexed so that every year it automatically goes up, and we don't have to fight this battle every year. The issue that fell into our lap last year was the child tax credit that was established in Vermont. That's a huge, and obviously it's a preferable direction than income supports that are tied to programs like TANF. What passed in Vermont was a $1,000 child tax credit for children 5 and under. And initially, when it came out, we were really blindsided by it. We didn't know that it was in development. It turned out it was very much a political gamesmanship thing that was happening, because our governor was going to put forward some tax credit proposals, and the legislature wanted to counter that with their own priorities. So we were thrilled. We got on board and supported it. We urged them to consider expanding the age range of eligibility, and in order to make that happen, potentially to bring down the eligibility thresholds at the top end, because initially it was incredibly generous and not very targeted at the folks who needed it most. It was a $200,000, $400,000 for single and joint income level. It landed at let's see, 125,000 household income, and then it starts tapering off, and then once you get to 175 household, and that's whether you're single or joint filer, the benefit goes away at that point. It is fully refundable, which is huge. We tried for periodic payments, and they weren't able to reconcile the impact that would have on some federal programs, which I think probably is familiar to all of you. So that's something we're talking about with our delegation. How am I doing for time, Jasmine? I feel like
you're good
okay.
up till, for a few more minutes.
Okay. The other thing that we're doing around family economic security is co-leading the campaign to establish paid family medical leave in Vermont. It has been a real battle. I think I may have talked about it in past years. We didn't really try anything last session because there was some hope, although very thin hope, that something would happen at the federal level. But now that hope has pretty much dried up, we are back to advocating for a state plan, and we have really strong support from the House. Again, the Senate's a little bit dicier, and we're in this super unfortunate situation where people are holding up the large proposed investment in early care and education, and pitting it against a paid family medical leave program, rather than considering them part of a continuum of support for caregiving and work. So we are working to change that narrative. I think one of the challenges is that the funding mechanism that's being proposed, at least in part, for the child care benefit is expected to include a payroll tax, which is obviously how paid leave programs are typically paid for around the country. So yeah, that's where we're at right now. I'd say we are continually making the point that economic security is fundamental to children's health and well-being. We're pushing the attachment narrative, the breastfeeding narrative for paid leave, the getting kids to their early well baby visit appointments, having them available for home visiting, just all kind of, you have that foundation, obviously layering all the other programs that the state invests in. It maximizes the impact of those. And then the connection to child welfare, obviously, supporting, reducing stress in the home, supporting family caregivers, and creating an environment that's will support children's healthy development. So I think I'll pause there. Since it's such a small group, I'm hoping we're gonna have more of a conversation for the end. So if I stop yammering, we can get there more quickly.
Yes, thank you so much, Michelle. Thank you so much for your work over the year. So we have questions and discussions at the end, but does anyone have any immediate questions for Michelle that you're burning to ask her right now? So you can feel free to unmute. Okay, if not, as you're thinking about those questions, feel free to pop them in the chat as Hannah is sharing, and then we can have the questions for both at the end after they both speak. If there are other aspects of children's health or family economic security that you'd also like to discuss, please pop those in the chat too, and we can discuss them. So thank you so much again, Michelle, for sharing your work with us. Now I would like to invite our second speaker, Policy and Outreach Associate, Hannah.
I know, it's a mouthful. Kornheiler.
Kornheiler, thank you. I meant to ask you that before.
You were not the first nor the last, so do not worry. Yeah, my parents put me in a little bit of a conundrum when they decided to mash up their last names together. Well, thank you for having me. I work for Advocates for Children of New Jersey. We were in a similar position to Vermont years ago when we had our Republican governor. Many of you may be familiar with Chris Christie. And after he left office, we now have Governor Murphy, who is a pretty progressive governor, and is now the head of the, I'm going to get the name wrong, like the Governors Association, and has chosen mental health as kind of his priority in working through that. So we have some exciting work coming up with mental health. Right now, the state is looking to kind of revamp our whole student support services through schools. Originally, there were small kind of school-based programs located in about 90 schools throughout the state, but that only reached about 2% of our student population and just wasn't scalable. So our Department of Children and Families is going through a revamping of how we deliver mental health services to students in schools, and they're looking to use like a hub and spoke model. And so there'll be 15 hubs set up throughout the state that'll have directors, case managers, and they'll be working to kind of connect students to different services, whether in the school or outside the school. And one thing that they did through this process was surveying students, talking to community members, and about 60% of students said that they would like to receive mental health services outside of the school. And so right now our student support services are located within the school. So this hub and spoke model would give kind of more options to students to be able to decide where they want to be able to receive those services and treatment. We also had about 9 million allocated in our last budget that would look at kind of increasing our mental health workforce. So creating like a psychiatry residency program, medical residency positions, adolescent and child psychiatry fellowships. And so just kind of trying to increase the number of professionals who are able to serve this workforce. And so it's been exciting to see those developments in our state. In terms of like our kind of health or Medicaid work, New Jersey launched a Cover All Kids program in our last year in June of 2021, which was part of our 2022 budget. And the goal was to get coverage for about 90,000 uninsured children. It's kind of a 2-phase process. So we're just finishing our first phase right now. And that's to enroll children who are eligible but are not currently enrolled. And so they've eliminated the 90-day waiting period for children enrolling in CHIP. They've removed premiums for CHIP as well. And actually all premiums have been eliminated for Medicaid, which has really increased accessibility for families. And then some funding towards targeted outreach to make sure that families are aware that their children can enroll. And then phase 2, which is hopefully beginning next year, although with the unwinding of the public health emergency and Medicaid agencies having to kind of re-enroll folks, we've been hearing they're a little maxed out at the moment, but we're hopeful the next phase will begin in January. And that's to provide coverage for all children who are income eligible, regardless of immigration status. So it's looking to provide coverage options for children of undocumented status and families whose incomes are over eligibility. So families who maybe are able to get insurance through their employer, but are not able to afford that, will be able to then access through our Medicaid program. So that's really exciting. To date, I think we've had about 26,000 more children enroll in Medicaid, and that's out of the 90,000 children that were not enrolled. So some really great progress, and looking forward to seeing what phase 2 of next year brings. And then some other Medicaid updates. We were able to extend coverage postpartum beyond 60 days to a year. So that's been really exciting. And then some work around doulas and Medicaid and getting doulas registered through our Medicaid CMOs and being able to provide those services through there, although many kinks to be worked out through that process still. And then we also had a young child tax credit passed this past year that families will be able to start claiming when they file for their taxes next year. Also a refundable credit like Vermont, but providing up to $500 per child under the age of 6. And so then it gets phased out. So the benefit decreases by $10 for every additional $1,000 of income that a family makes until it reaches $300 per child for a family earning up to $80,000 per year. So I think the only issue is that families do have to file for their taxes to receive it, and so I think we're looking towards doing some outreach in the next year just to make sure families are aware that they can claim this credit, but that they have to file to get it. So yeah, we'll see how that rolls out in the next year. And I think that's all of kind of our family economic health updates at the moment.
Thank you, Hannah. Thank you so much. And thank you for your work as well over the year. Does anyone else have any challenges or wins that you would like to share? I'll pause for a minute as you think about that. and or any questions for Michelle or Hannah that you want to pop in the chat or unmute and ask?
I have a question for Hannah. So I'm curious, you referenced your tax credit as a young child tax credit. This is a silly thing, but one of the things I tried to get changed at the end and failed, shockingly, was to get ours named a young child tax credit, just because that's what it is. And there's just this concern if we come back and try to expand it, that it's like imprinted on legislators' minds. We already did that, you know, and so really like being more specific. And so did you actually name it that in your statute? Yeah.
Yes, it was another organization that took the lead on this and we supported, but I'm fairly certain, yes, it says young child tax credit under the age of 6. Yeah, but that's such a great point, and I should chat with our partners if that was kind of intentional in something they did to kind of say this is a young child tax credit, and that it could be kind of expanded a little more broadly in the future.
Yeah. I will say too, that we are hoping to expand upon that a little bit this year. The goal is maybe to expand it to I-10 filers or whatever, because ours does not include that population right now.
Yeah, but I'm happy to connect you to our partners who kind of took the lead on this if you're looking for additional information on it.
Sure, yeah.
Well, I have a few questions while people are asking. So first, for Michelle, when you were talking about the Reach Up program, you were saying how you're explaining how you expanded the eligibility for the Reach Up program. And you were talking about how it essentially got rid of that work requirement piece. Can you share some of your narrative framing or the advocacy work that went into changing people's like set values and perspectives on that?
Sure. I mean, I think there was a lot of, there were two main approaches. One was, we've been doing a lot of work about helping people to recognize how the systems we have in place are rooted in white supremacy. And so talking about the racist roots of TANF and child protection, actually. And so again, those two conversations have been sort of hand in hand. And then honestly, really downplaying, being really careful to not say in public, we're getting rid of work requirements, but just like, we're focusing the program on reducing barriers and recognizing the complex barriers that families are facing. And so like, you can't like, you know, pushing people into frankly dead end work experience placements where they're not actually gaining any skills at the same time. I know I'm preaching to the choir here, but at the same time, they're being expected to attend, you know, counseling and, you know, fix their bad credit score and just all this stuff. It was, so we just said, let's really let a lot of, I should say too, that our, the department, the economic services department, the person who leads the Reach Up division is an amazing champion. Like, she fully gets it. They've been working with Donna Pavetti. Like, they're really, a lot of this actually goes to Donna's partnership with them and helping them understand that, like, if we're going to have employment be a route out of generational poverty, we have to like really focus in on what the real barriers are, not to sort of like, I don't know what, like imposed barriers that that some lawmakers like to put in place. And so it's like, you can't expect people to be consistently showing up for work when they're unhoused, right? And so let's have the house, let's take care of their housing first. And so the list of things that gets included as participating includes all those kinds of things. It includes, you know, addressing your children's educational barriers. It's, you know, it's just very comprehensive. So I think downplaying, you know, what we now use as a shortcut by saying we kind of got rid of work requirements, we did not use that language during the campaign at all. Downplaying that and really focusing on centering the experience and voice of people who are impacted and who are in the program, and letting them tell us what they need, what their real barriers are, and centering the program on that.
Thank you, Michelle. Any questions or follow-up clarification questions for that answer? If people have another question, I don't want to hog it. Please put it in the chat, but I do have another question if not. I'm taking a look at the chat. So this one is for Hannah. You mentioned in phase 1 of your outreach for Cover All Kids that you want to have targeted outreach to let families know that they're eligible. Can you share, and I know it's in the planning phase, but can you share any specific strategy that you have to really center equity, different, aspects of equity, and how you anticipate that being implemented, any obstacles that you're anticipating with that targeted outreach and centering equity?
That is such a great question, and I do not have an answer. I know that this is happening through our state Medicaid agency, and I just haven't been as involved in these kinds of discussions about how they're doing targeted outreach. But let me speak to some of our colleagues here, and I can email you some information that you can share.
That would be amazing. And if anyone else on the call has had, experience over the year, I know with getting people to know that they can file for it, you mentioned Michelle, but for the federal child tax credit, there was a lot of advocates who are doing education to reach families to let them know that there's still time and the benefits. So anyone have any lessons learned for how to do, outreach in general for letting folks know about some of these benefits that have come up and centering equity in that outreach? No, everyone's thinking about cookies.
I will say one thing we're looking to do around the child tax credit is, and something that we've been working on here at ACNJ for a few years now is engaging parents and parent leadership. And we've formed a parent leadership council and are really working with parents kind of at the table to help develop ideas, solutions, policies. And so we'll be holding a meeting in January with some parents and having a conversation around how can we do kind of more targeted outreach to parents. And I think just in general, like when you're like, I don't know, how do we do this? I think going right to the source, folks who are experiencing these issues and having conversations with them and hearing from them about what are the right approaches, where are parents located, what's the right messaging to have when you're speaking to them, I think is always kind of a good direction to go in.
Thank you, Hannah. And thank you, Crystal, for that comment in the chat that Facebook was really helpful for doing outreach, different modes of communication. Well, I will give you 2 minutes back of your time. Thank you so much. I cannot thank you enough, Michelle and Hannah. I know I reached out at, so close to today, but you guys just turned around and shared so beautifully the work that you've been doing over the years. So thank you so much again. We will resume these partnership peer exchanges in January. And with that, as you guys are logging out, I'll just put a link in the chat. If you do have some topic that you're looking forward to talk about next year, please definitely submit that in the forum. But thank you so much again, and happy holidays to everyone.
Thank you. Bye-bye.
Thanks.